El Paso County Public Health Board of Health for 24 March 2021. And our first item really we should do is the board member roll call. So Vicki, can you help me with that? And we'll find out who's here on either in person or virtually.
Sure. Commissioner Cammie Bremer.
Cammie was having some connectivity problems. She's on the road today.
Commissioner Lajinos Gonzalez.
Morning, everybody.
Hey, good morning. Morning, Commissioner.
Councilmember Yolanda Avila.
This is her assistant, Jessie. She should be here in about 10 to 15 minutes.
Okay, Jessie. Thank you.
Jesse. Councilmember Sam Geek.
Okay.
Carney Kilroy.
I'm here.
Karen.
We have Dr. Bucks in the room.
Bucks. I'm here. Okay.
Horace Ralston, are you online?
I am. I'm here.
Okay, good. Well, that's great because we have a quorum. Okay.
And Vicki Browerman, are you online?
I see a VB.
That's me.
Oh, okay. We have two VBs.
All right.
Vicki Borman.
Well, we do have 5. We have a quorum.
Okay. All right. So our first action item is the approval of the agenda. You should have that. All board members received a packet, and having given that a good look, I'd entertain a motion to approve the agenda.
So moved.
Okay, all in favor?
Aye.
Aye.
There we go. Okay, Board of Health comments. I really don't have any comments this morning other than to springboard off of what we talked about at our last meeting and to the idea of exploring Public Health 3.0 and the partnerships. And I just particularly, after the events of, this last month and in this last week, I want to emphasize our partnerships with, first of all, public safety, but then clinical medicine. Public health and clinical medicine providers are locked at the hip. So anyway, those are the two things that I've been thinking about. The other thing I will mention is that for those of you who are unfamiliar with NALBO, the National Association of Local Boards of Health, I've been kind of getting an education in my free time about the services and products that NALBO offers. And I think there are some things that we could entertain at our next board meeting, perhaps, that have to do with best practices, good governance for, I think we're doing those things, but I think it would be good to take note of those that we're doing well and Gesundheit, and also to look at what we could do better. Other Board of Health member comments this morning, please. Hope everybody's healthy. Any other Board of Health member comments? Okay, next action. Oh, Sam Geek, I see a hand. Sam, please. Does that mean you're here or you want to speak? Okay, well, we'll check you off as being present. And any other hands up, Vicki? I'm having trouble with the technology this morning.
No,
we're good. Okay, next action item is approval of the minutes. Likewise, you have those in front of you. So having reviewed those, hopefully before coming to the meeting, any discussion? Otherwise, I'd entertain a motion to approve.
So moved.
Second. All in favor?
Aye.
Great. Nikki Simmons, are you out there?
I am. Good morning.
Would you please give us an update about the financials for February, and then we'll looks like we have a contract to talk about. Please go ahead, Nikki.
And I will be brief this morning. I know you guys have a lot to go through.
Okay.
So on the screen, you have the summary through February 2021 for the first 2 months of your fiscal year. As you can see, there are still several areas where we are running below budget on revenues, but 90% of that variance has to do with the restaurant licenses, which we still anticipate receiving a purchase order from the state of Colorado to recover those restaurant inspection fees that we have waived underneath the state bill. And so most of that revenue will be recovered. But at this point, we are also operating $731,000 below the expenditure budget. So a net variance to budget of $107,000, which is very close and something we're not concerned about. And we anticipate the revenues coming in shortly, working with the state to get those in. So overall, I have no concerns about the budget. We continue to track significant upcoming funding for COVID response, as well as vaccination pods. And so we do have enough funding to cover those, as well as working with the county funding to cover any expenditures that wouldn't otherwise be covered. So we don't anticipate having to spend any further into fund balance than the budget says to continue this COVID response. So that's my brief financial summary. I'd be happy to answer any questions.
Questions for Nikki, please.
Awesome. And then we also have one contract.
Okay.
You are all given a contract synopsis in your packet. And I think Kyle Unland is here on the line to actually go through that contract to explain it and see if there's any questions.
Yes, I am here. Thank you so much, Nikki. And good morning, Board of Health and members of the board. I'm here to talk to you about this grant we received from the Office of Public Health Planning from the Colorado Department of Public Health and Environment. This contract is related to an effort that we will be doing to promote our South building and continue to support the wonderful effort that went into the establishment of the South Public Health Building. Now that the location is open, it is imperative to further develop a strong and trusted presence within the community. Targeted outreach efforts in combination with exclusive community building activities will strengthen this relationship. So the intent is to hire one FTE to be able to connect the dots, to be able to develop those relationships in the communities around Southeast Colorado Springs, City of Fountain Valley, to be able to understand the services that are available at the South Building, and also develop those relationships so that we can have a really influential part of how to promote public health within our southern communities. From this piece, the grant funding continues till September 31st, but our intention is to sustain and look for other funding sources to sustain this effort in the years to come, so that we know that relationship building is something that isn't done in a short time frame. It takes a long time. So we are committed to try to continue this effort and continue the presence of our operations in South El Paso County area. Any questions at all about the contract or the efforts to continue forward with this?
Well, Kyle, just one comment. I see here that also one of the staff members that will be hired for a community outreach coordinator is bilingual, and I see that as especially important in that part of our county. Any other Board of Health member comments or questions regards this $50,000 grant? Yes, please.
I wanted to recognize Carolyn Gary, who is our new part-time development officer. And she's been very busy working on grant proposals, and this is her work that she was able to secure the $50,000. And with all of our points of dispensing and our goal to get that clinic up and running at a minimum 5 days a week, if not 7 days a week, it's critical that we have a bilingual member of our team that is available, because we know that trust is so important. And we also work with Cerveza de la Raza and RISE as well, but this will be integrated and to pick up the momentum and continue building or enhancing the trust in the south portion of the county.
Well done. What's the name of our development officer again?
Carolyn Gary.
Carolyn Gary.
Carolyn Gary, and she's made a number of submittals in coordination with some of our staff members, but I do want to acknowledge that she's been steadily working, and this is a result of her work.
Well, that's great. Well done. We'll probably hear that name again from time to time. Kari, you have your hand up, please.
I did, thank you. Just a brief comment. I think this is a wonderful direction to go. I'm really glad to see this and appreciate all the work that the staff and Carolyn have done for this type of position. I think that's going to be very important going forward.
Very good. Other Board of Health member comments or questions? Okay, I think we need a vote on this one. And so without further ado, I entertain a motion to approve this contract. So moved.
Second.
All in favor?
Aye.
Aye.
Great, thank you. Okay, next item is, let's see. Oh no, we're going to have to say farewell to a couple of our Board of Health members. It seems like it's been.
Oh, may I make a comment?
Yes, please.
Move off of finance?
Yeah.
Sorry about that. Before we let Nikki leave, I did want to make a comment here for everybody and the senior public health staff. Is there anything we can do funding wise? We do have the reserves that we can do today that helps us get to, getting as best position for, vaccinations, et cetera, because I think Nikki and others on public health leadership, Susan, are probably going to do a very good job of making a request for funds that will likely come in the next 45 days from the American whatever funds that I know we're going to get at the county level. Is there anything we can do today, and perhaps even go into fund reserves with a likely understanding that would be reimbursed? So I don't want to miss out on something we can do today instead of waiting 45 days from now.
Thank you, Commissioner Gonzalez, for that comment and question. Director Whelan, any?
Nikki, do you want to say a few words, and I'll tag on to you afterwards to give some perspective on how we're approaching funding and supporting the expansion of points of dispensing in the community?
Absolutely. So at this point, I don't feel like we need to dip into our public health fund balance any. We have several funding sources available to properly staff and set up those points of dispensing before we would look at fund balance. The first one is we are expecting about $1.8 million through CDPHE from federal vaccination funding. That's going to be our primary source of funding for that, which will help us do almost all that we need to do. We also have FEMA funds available. And so we are working with the DHSEM through Denver to be able to access those funds. We also have some CARES funding remaining that we are using. And so besides those three, I don't feel at this point we need to even consider using public health general funds, and then hope those would be reimbursed through the American Rescue Plan Act funding that the county will be receiving. That being said, I do believe that public health will be a priority in that funding based on the conversations I've been having with county leadership. But I don't believe at this point we need to do anything. I think public health is well set funding wise for what we need to do points of dispensing.
I think that's reassuring to me, and I think that's going to be reassuring to the public to hear that. So thank you very much.
And Susan, did you have?
Sure. I wanted to say thank you, Nikki, and then also Commissioner Gonzalez. As you're well aware that you and the Board of County Commissioners and also the Board of Health has made public health a #1 priority for this response. And I'll get a little bit more into the details about our triple action plan and how we're planning to expand in anticipation of getting more increased supplies of vaccine, because our #1 challenge for our department is staffing and human resources. And we'll talk a little bit about how we utilize many different volunteers through the Office of Emergency Management, and how we're also receiving some state support as it relates to some staffing support for these points of dispensing. We'll get into that, but I just appreciate that you continue to acknowledge that the work that we do, and that it needs to be well funded, and that it is a priority. So thank you for that. And Nikki has been very helpful in navigating all the FEMA reimbursement and ways that in which we need to make sure that we're not 20 steps behind when there's increases in vaccine, that we're poised and ready to expand our vaccination efforts throughout El Paso County.
Good. Commissioner Gonzalez, again, thank you for that question, and you're very welcome to ask it again in a month. Situation may have changed, but right now we're good. Okay. Any other Board of Health member comments about finance and budget? No? Okay, next slide. All right, this is bittersweet. By a strange coincidence, maybe not, we have two board members who have been in service to our community, and specifically to our Board of Health, for 2 5-year terms. So 10 years in the saddle, so to speak. I'm trying to remember what I was doing 10 years ago. I think that was back with Alexander Fleming and penicillin, wasn't it? So, that long ago.
All of us.
So, I'm not that old. Okay. So, ladies first, Vicki Orman, and we're gonna make a kind of a big deal out of this and see if we can embarrass you. But the point being, we wanted to say thank you so very much for your dedicated service for 10 years. And that is not a small accomplishment. And I wanted to say personally that I have really appreciated you and your insightful questions in these board meetings, because I really think that helped me. And as your duties also as Vice President of the Board of Health, I knew I could rely on you to get to the meat of the matter, and if needed, conduct the meetings without any drama. So thank you very much. I think we have some other board member comments for Vicki Borman.
I know Commissioner Bremer was going to send some videos.
Did we get that video?
Yeah. Okay.
The video? Well, that sounds ominous. Okay, we're gonna skip the video. So there's the camera. We're gonna do an elbow bump here.
Thank you.
For benefit of the board members, and a photo op. Here we go. Thank you, Vicki. And could you maybe also tell us about what your new job is, what you're going to be doing?
Dr. Turbish, can
Yes.
I say a few words?
Please,
Just before
Director
you go
Wheeler.
into your future, but I just wanted to thank you, Vicki, because we've worked very close together. I've been with the agency for 20 years, and in 2011 you became a Board of Health member, and you've been completely engaged and supportive of all of our work. I want to point out two things that you really championed with the Board of Health and also increasing funding. So one of them for the Women's, Infant, and Children program, and taking the initiative to help us funding for that program. And that was quite some years ago. I don't know exactly what year ago that was, but the importance of moms and babies and nutrition has been something that you have a lot of passion for, and which has helped our program and our agency advance. So that's one. And we only came up to that with your support, including the Board of Health, and using those fund reserves. And I can't imagine not having that strong team, and that strong team also includes the development of our data analytics office. So you are part of that. So thank you. And then the last thing, which is really exciting, and I think that our county has needed for a while, and sometimes, there's you have to wait for the right time for things to come together, but your support and engagement of the purchase of the south building in the southern portion of the county. So thank you greatly. I know that you came out there to visit the site with a couple of times, and I've also just appreciated that, you texting me or calling me and asking me if I need, what do I need? And it's focused on, the entire team, not just me as an individual. So I am going to miss you. And I still have your cell phone number. And I think the world of you. I mean, we attended the National Association of Board of Health conference together, where we, got to know each other a little bit with Kari and Dr. Turbush. But I just want to say how much I appreciate your volunteer service, because there has been a lot happening within the 10 years that you have been serving on this board. So thank you. I appreciate you. And the public health team appreciates you. Thank you very much.
Thank you, Susan. Other Board of Health member comments? Yes, Sam's got his hand up, please.
Can you hear me?
We do.
Yes, I would like to thank Vicki and Dr. Bucks both for all the support that I've received in the south end of the county here in Fountain. And I just really appreciate the help that they've given me, and thank you very much.
Thank you, also Councilmember Gay. Let's see, we have Commissioner Gonzalez has his hand up, please.
Oh, thank you. I too want to thank Vicki and Dr. Bucks for all the great work they've done for us. I mean, so many things that they've provided input on and mentorship to me on public health over my first 4 years. We clearly have been a better board for their involvement these past 2 terms for them, but greatly appreciated from me and the county commissioners. Thank you so much.
Thank you. All right. Well, and we have another farewell gift for Dr. Robert Bucks, if you wouldn't mind. Yeah, although there's we'll stare into the big eye. And thank you, sir. And photo up, there we go. Okay, and just a few personal comments. I really enjoyed getting to know you, and not all the folks here know what a colorful background you have, and plus all of the service that you've provided to our community this last 10 years. And I hope that you might also check in from time to time with us, and we have his phone number too, right? Okay.
We have his cell phone number also.
Okay, very good. And do you have any comments for us about what you think you might be doing next? I think I heard about a project that you're doing.
I've been doing medical legal consulting since probably 1985, and I'm still doing some. And the last 2 or 3 years, it's kind of gone to focus on innocence projects. And I've got a few cases with that. And we also had one of a man that was on death row in Louisiana that is now free, based on some faulty things that occurred in his trial and with the quote experts they had that testified. So that's one thing. And then I'm going to spend some time with my grandkids, and my wife and I are going to travel here once we all can travel. And I'd like to make one comment. I don't know about Vicki, but the most important thing that I think that I've done on this board, and I think Vicki too, because I think you were here, well, you have to realize we're on Public Health Director number 4. Okay. And Vicki and I were on the search and interview committee for 3 of them, the last 3. And that to me was one of the most important things and the most satisfying thing is to watch each of those directors bloom and move us down the street. And now we're in the middle of an expressway. I mean, that's the way this department is working. We're not on a country road anymore. So, thank you.
Well said. Well said.
Can I say?
Yes, please.
Yeah, try not to get emotional. It's been a privilege and an honor to serve the citizens of this county and to work with such incredible staff. And I was thinking about this last night, and Bob and I our first meeting together was in that old moldy conference room.
Asbestos still. Let's make sure we put all the adjectives in there.
Yeah, it was rough. So to see in 10 years what the El Paso County Public Health Department, Bob touched on it, has become is incredible. We moved over here, we had fire, we had flood, we had fire, we had flood. We weren't getting we still aren't, but we're better getting the population money that we should to serve our citizens. And somehow your staff figured out a way to make it all work. And that's incredible. Now we have I forgot about the pandemic. I'm going to forget about the pandemic. But we also had a hepatitis pandemic, and not pandemic, but hepatitis outbreak. And so many things have occurred here. And it's been a privilege, and it's been an honor. And I don't know what I'm going to do every third Wednesday of the month anymore. But, obviously, nursing is my passion. That's what I do. So I've been given the opportunity to develop and grow a nurse trauma navigator for the state of Colorado. And I'm looking forward and jumped into that and pretty excited. So thank you. Thank you for trusting me, and thank you to the commissioners who are no longer here, but who appointed me to represent the citizens. I am humbled by that. So thank you.
Well said. Thank you.
And I would echo for me also that it has been an honor to have this job, and you've been given the trust that has gone along with it. And that's something I'll remember always also.
Well said. Very well done.
Dr. Trevors, I just want to
Yes,
say a
please.
few things about Dr. Bucks as well, if that's okay. I wanted to to just mention too, I mean, you've supported us in building our infrastructure with the 10 full-time employees, and that has been very much appreciated, and also has been a champion for the purchase of the South Building. And I think something that is very notable with your leadership within the past few years, back in 2013 and 2014, is your office's leadership with the Child Fatality Review Team and the development with us spearheading the Teen Suicide Prevention Group, which is a very active group still. There still is a need, and that coalition and those partnerships with multi-sectors have, they are still diligently working and still a lot of work to do, but that was with your office and your leadership, and I appreciate that. And you guys bring back memories as well, because since 2011, when you both started, there has been numerous changes and a lot of progress. But I wanted to echo what you both are saying too, is that the incredible team that public health has, we may not see them at this meeting all the time, but they are dedicated servants, and they are so much expertise. They are just an incredible team. So thank you for acknowledging that, because they care deeply about this community, and with your leadership and support on the board, it helps our entire team do the work that we do. So thank you.
Dr. Turbish?
Yes,
Councilmember Avila chatted in a couple comments. Do you mind if I read them, since you can't see them? She said, this is from Councilmember Avila. She said, Vicki, I really appreciated your good work and your thoughtful questions. I learned a lot, and I was grateful that I was able to sit next to you before we all went virtual. I wish you the very best. She also said, you're both amazing, and El Paso County Board of Health is so much better for it. And Kari typed in, ditto to everything everyone has said about both Vicki and Dr. Bucks. I've learned so much from both of them with their different styles, approaches, and perspectives. Our board is stronger because of them, and they will certainly be missed.
Well, there'll be a huge void as you leave, and you will both certainly be missed. And again, thanks from all of us for your service these past 10 years. Okay, I was already asked at the meeting about new board members, and so I don't want to take anything away from the farewell of Vicki and Bob. I will just say that there were 14 applicants, so this is a highly sought after position. 6 were interviewed, and there was a rigorous process, and that I think that the county commissioners still have to, I think it's kind of like a saint in the Roman Catholic Church. You have to be beatified or something. So there'll be a process and a vote, and then at our next meeting we'll have 2 new board members. But anyway, we'll miss you guys, and thank you. The other, as you can see, bit of business that we need to do is that because Vicki's going off the board, we need to elect, vote on, discuss a new Board of Health Vice President. And let me just say, I've thought about this, and I would like to nominate Doris Ralston to be the new Vice President, and here's why. Doris, I'm going to embarrass you a little bit here, but you're always faithfully at our meetings. You ask good questions, and you have thoughtful comments, and also you call me and have additional comments and questions, which I really appreciate, and tells me that you care a lot about this Board of Health. And one other comment I would make is that I know because of your service on actually a number of boards, you know how to run a meeting in case I'm absent for whatever reason. So let me just roll that out there and ask for comments, questions, or additional nominations from Board of Health members, please.
I'm moving. Close nomination.
Second.
Doris Ross by acclamation.
There's a, okay, I was wondering if it would go in that direction. Kari, I've got a hand raised.
Yes, thanks. I just wanted to second that motion. I think that Doris is a great suggestion.
Okay, well, let's cut to the chase. It's been moved and seconded. Let's take a vote on Doris Ralston as our new Board of Health.
Dr. Turbish,
Yes,
we do need to do a roll call vote.
A roll call vote. Well, that makes
I can,
sense.
if you'd like.
Would you conduct that, please? Thank you.
So please give a yay or a nay when I call your name. Commissioner Gonzalez?
Yay.
Councilmember Avila?
Yay.
Councilmember Keith?
Yay.
Vicki Browerman?
Yay.
Kari Kilroy?
Aye.
Dr. Bucks?
Hey,
Commissioner Bremer, just checking if you are on. Okay. And Doris, I guess, do you accept the nomination?
Well, that's right. We need to see if Doris will actually do that. I sort of previewed that with her yesterday. But Doris, will you accept?
Yes, it would be an honor. Thank you.
Oh, thank you. Well, sort of put the cart in front of the horse on that one. And
I think we're all.
certainly I from, okay.
Yeah. All right.
All right. I think we did it. Okay, and thank you all. Okay.
Congratulations, Doris.
Yes, congratulations, Doris. Let's
Thank you.
hope you really wanted to do this. Okay. The next action item is easy because it's a resolution designated April 5 through 11 as National Public Health Week of 2021. And should we read this into the minutes? Okay, let me get to the right page here. Sorry. So there we go. Thank you. As usual. Okay. I'm going to read into the record the resolution of the El Paso County Board of Health designating April 5 through 11, 2021 as National Public Health Week 2021. Whereas the theme for National Public Health Week 2021 is Building Bridges to Better Health, and whereas the top priority of the El Paso County Board of Health is to make communities safer and healthier, and the COVID-19 pandemic has made working toward this goal even more important. And whereas the mission of El Paso County Public Health is to promote and protect public health and environmental quality across El Paso County through people, prevention, and partnerships. And whereas the vision of El Paso County Public Health is for all El Paso County residents to live in thriving communities where every person has the opportunity to achieve optimal health. And whereas while people may be physically distant from each other at this time, social media and virtual platforms make it possible to connect, create, and continue to take action. And whereas El Paso County Public Health continues to meet the needs of the community by making additional resources available online and through social media, conducting virtual meetings and appointments, and promoting practices that mitigate the impact and spread of COVID-19. And whereas the El Paso County Public Health strives for a healthier future for our community in the midst of the most challenging public health crisis of our lifetimes, and whereas it is more important than ever to celebrate the public health, keep the conversation going, and continue to thank El Paso County Public Health staff for all the hard work to keep our community safe. Now, therefore, be it resolved by the El Paso County Board of Health as follows. The week of April 5 through 11, 2021 is proclaimed as National Public Health Week 2021 in El Paso County, Colorado. And 2, El Paso County Public Health is encouraged to support appropriate activities in El Paso County to promote the National Public Health Week. And we need to take a vote. Any discussion? Okay, I'd entertain.
Turbish?
Yolanda, yes, please. Councilmember Avila.
I'm sorry, I'm just having a little trouble here, but yesterday at the city, we did a public health resolution also for the week of, I think from the April 14th through the 4th through the 10th. Anyway, we acknowledge all the amazing work that the entire staff and employees are doing in public health and how they brought us through this horrible pandemic, but also doing so much more that we kind of forgot about, right? You were once somebody said hepatitis A outbreak and the teen suicide, and we were talking about the vaping, and but we were doing so many things that we were taken for a loop, but the way that public health has handled that under the direction of Susan Whelan has just been incredible, fluid, and bringing together. And I think this is such a great resolution. I just wanted, all you know that Susan attended, and we honored Lisa and Kim. But the city is eternally grateful to the Board of Health, the administration, the city council, and all of us are so grateful for all the fabulous work that's been done.
Thank you. That's very gracious. Yes, Director Whelan.
I wanted to mention that, so we did a briefing with the Colorado Springs City Council, and we got a standing ovation for the entire public health team. Every single council member stood up and clapped in support of public health. And I heard the words, from Wayne Williams, such as, what an awesome team. I mean, there were so many words of gratitude and appreciation. And we highlighted, because we can't highlight everyone, all of the great work, given the time that limits us. But we were able to acknowledge our communicable disease team and the important role of prevention and contact tracing. And we also acknowledge that our emergency public health team has been the foundation of our response, and all of the time that we have invested in the planning, the training, the exercises, the full-scale exercises with the public health system, first responders, healthcare. So they were acknowledged yesterday, and they were able to take a photo with the city council. But I just wanted to say that we've been working very well, as you know, with Mayor Southers and the entire city council. And thank you, Yolanda Avila, for sponsoring the resolution. And I also wanted to say that the city council many times acknowledged the important work of the Board of County Commissioners as well as the Board of Health, acknowledging how we're working together. So I appreciate the opportunity, Yolanda, for me and my team, because it was really uplifting.
It was our pleasure.
Well said.
May we take a photo with our resolution, with our...
I think we should do that. Now, the signs, I did go ahead and let's see, where's that red folder? Okay. Okie doke.
And Dr. Bucks and Vicki. We took a picture with the city council, then we're doing another resolution April 6th with the Board of County Commissioners.
Okay, well, this one says draft, but we'll have the real deal
okay.
In a minute. Okay.
And taking our masks off for us. We can take them off. I wanted a picture with, Dr. Bucks and Vicki.
There we go.
Other members of the team, you're fine to come up here.
Y'all need to come up here. This is about you guys.
Yeah.
Come on.
Come on.
Come on.
Yeah.
Come on. We're taking them up.
Yeah.
Yeah.
Okay, that's the order of the, I think we got our shots.
All righty.
Well then,
Yes.
3, 2, 1. One more. 3, 2, 1.
Excellent. All right, thank you.
Thank you.
All right.
All righty, well, since it's been recorded forever by a photograph, maybe we should take a vote. Move to approve this resolution.
Second.
All in favor?
Aye.
Aye.
Great, thank you.
Aye.
Thank you, everyone. Okay, I think we are up to the director's report, please. Director Whalen.
Before we jump into the COVID update, I know that you all are interested in the legislation House Bill 21-1115, and Commissioner Gonzalez, you're probably up to speed on this, but what I understand is that it was heard yesterday, and it was the legislation was turned into a training requirement bill. And so the areas of concern for our Board of Health no longer exist, and it passed on as a training bill, went through, the Committee of the Whole, passed out of Transportation and Local Government Committee on a 7-4 vote yesterday. And Commissioner Gonzalez, I didn't know if you had any additional details, but I did want to let you all know where that status was.
Thanks, Susan. Yeah, so we did get an email on this. I don't know if it was at the end of last week or at the start of this week, indicating a couple of additional changes and amendments by the sponsors to try to get some support from counties. I mean, we don't get the vote, but they wanted some support. Unfortunately, their changes were, it said, well, county commissioners can remain a part of the board, not a majority, but again, the small counties, the rural counties who we were all supporting on this, who could have gotten kicked off their boards. The revised amendment said they could remain on the board, but if a public health board that included county commissioners ever didn't follow a state CDPHE executive order, then the state could remove the county commissioners from the board. So it was a little punitive, but the response from the emails, because I got CC'd on the response from the counties, every response that I saw, and there were numerous, remained in opposition. And so at the end, I think the sponsors decided they didn't have the support that they would have liked for some of the significant changes, but they did want to make public health aspects a little bit better, and so they went with it as a training requirement for all public health members.
Commissioner Gonzalez, can you kind of flesh that out a little bit? We've both been in the military, and we know there's a big difference between training and education. So what are we trying to do? Train board members or educate board members?
Well, hopefully it's education. I think it's going to be, well, actually, I don't know what groups they're going to use. I know there's some perhaps maybe national standards. I think you might be aware of some, Dr. Turbush. I think you had highlighted something to me. I would hope they would go with something that most people have or our professionals are familiar with and supportive of that could help us.
I am familiar with, as I mentioned, NALBO, the National Association of Local Boards of Health, and just by going to their website and browsing around a little bit, I think there are lots of resources for boards of health that would probably fit in the category of education. So let me just kind of roll that out there. I don't know what the legislators are imagining as this training requirement, but there's certainly some good resources out there that I think would be acceptable to our health department and to our board. So any other board member comments on this important piece of legislation that is still being debated at the state level? Okay, thank you. So,
Okay. A couple of things before we dive into the data dashboard and give the COVID update. There's many emails of appreciation for the work that public health is doing, and I always can't read them all, but I would like to read one of them. It says, it was a nice card. Thanks to all of the employees and volunteers for our wonderful J&J vaccination experience on Sunday, March 7th. Every part of our experience was truly wonderful, from the parking lot volunteer to the recovery personnel. We are so truly grateful for how efficient and kind the entire group of people involved were in getting so many people vaccinated. David and Martha Pitts. And this is a handwritten note, and we also received emails, but just wanted to stress that, with our small but mighty team and public health team, they know the flows and clinical safety practices and how to put those together. In addition, with our partners that with the vaccine consortium, Matthews Vu and the hospitals and working with the fire department. But I want you to know that we're receiving much feedback related to the appreciation. And then we also passed the 1-year anniversary for our COVID response. And we partnered with the Board of County Commissioners, the chair, Stan Vanderwerf, as well as Mayor Suthers, Council Member Strand, and we had a remembrance at the Pioneers Museum, and I just wanted to read what was provided in recognition of the efforts, and public health was referred to as unsung heroes, but then also Commissioner Vanderwerf took the opportunity to talk about the work that we do, because a lot of the work that we do is on prevention and it's not tangible. But we know that there have been many illnesses and severe illness and deaths that have been prevented due to public health efforts. So this is El Paso County Public Health. Really appreciation for being my COVID hero. All staff during COVID-19 pandemic, and in recognition of the many sacrifices made and the courageous actions taken, we recognize you as a true hero to our community. And so this is something that was presented to us by Commissioner Stan Vanderwerf, and we'll put it up in the hall in the main area of public health, but wanted to acknowledge that because there's so much that goes on a daily basis. So thank you for allowing me to offer some more positivity around all that's been going on, because there's definitely been so many challenges and stressors, but there's been some also shining stars, as Commissioner Vanderwerf said, that there's many shining stars in the darkness. And with that, Stephen or Fadi, could you give us a data update, and then we'll go into some vaccine updates and take it from there.
Sure. Good morning, everyone. We'll be giving some high-level case updates as well as vaccine updates. Let me transition to sharing my screen.
Yes, very small, but yes. We see the colors.
We're squinting.
Let's see. Is that better?
The green and the blue and the green really are the changes for the new dial that went into effect today.
It's important that you describe what is on the slide, please.
Sure. Yes, as Susan mentioned, the dial 3.0 went into effect today, in fact. For us right now, our current status, not much change. We're currently in level yellow, and the metrics thresholds did not change from going from level yellow to level blue. We still need to drive our incidence below 100 per 100,000, and our positivity cannot be greater than 5%. So per our current status, nothing changes for us. There was a slight change from going to from blue to green. Now, if incidence is below 35 per 100,000, now it is level green, where before it used to be level blue. I'll be transitioning to giving a brief update on our current status with some specifics. Right now, our incidence is about 149. It's been remarkably stable between 110 and 150 for about 2 months, a little bit more than 2 months now. It's in that lower spectrum of yellow, but it has not budged to go below 100 so that we can be eligible for blue. Our positivity has been rising recently. It's a little bit of a concern there. We did see 10 days of positivity that's less than 5%, which at that time made the positivity eligible for blue, but recently it has increased above 5%, and currently it's at 6.15%. So that's it for the cases update for today, but I did want to transition to a brief high-level update on vaccine activity. As you may have...
Claudia, before you do that, let me just emphasize the dial, the 3.0. So yesterday evening, the State Health Department sent some information as well as a news release, putting everyone on notice that it goes into effect today. So some counties it will benefit them to being able to expand capacities or percentages of capacities. However, as Fadi said, that we are in the yellow and we continue to be above 100. And so El Paso County's 7-day incident has to get below 100 in order for us to have any significant changes in the blue or the green, which would be increased capacity to 75% or even greater than that. The last time that we had we dipped below 100 7-day incidents was October 14th. Correct me if I'm wrong, Fadi, but that's what my memory states. So October 14th was the last time that we had that low incidence. So some of these changes on the 3.0 dial do not affect El Paso County. And so I did want to make mention of that since it's so new and we still need to look into the various different areas and have a better understanding. That we work with all of our business community, including the restaurants, to provide guidance on that. And as a refresher too, there was a stakeholder process with the state. They sent it out through, I believe, the media and had various different stakeholder meetings to gain input into the 3.0. But it's going to take local public health a little bit of time to dive into some of the details and then work with the different sectors on what that means. But globally, our numbers are not below 100 7-day incidents, and it has to be below 100, and therefore some of the 3.0 dials or changes are not going to affect some of our operations currently.
Susan, can I ask you a question? You're hearing a lot on the media about this spring break spike.
Mm-hmm.
When are you guys going to be really keying in on that? When are you expecting to see a spike?
Mm-hmm. So we continue to monitor, and that is on our radar, and I'll ask Fadi to give some more insight into that question. Fadi, did you hear?
Yep. Usually what we used in the past for Thanksgiving, Christmas, New Year's, or any major holiday is a 14-day period after the end of the last day of the holiday, so that we can see and observe if any spike occurs. One of the concerns about the spring break is travel. So we're hoping to see little to no effect because of an increased activity during spring break.
I have a question too. On the incidents per week, have you broken that down at all to age groups?
Yes, we do display and monitor demographics by age, sex, and we can look at most recently. For example, if we take a look at March 20th, March 14th, we can see if there are any patterns. Right now, we haven't really. Nothing has sort of gathered immediate attention, no red flags yet. We do know there might be a little bit of a change in hospitalizations, and we have seen less deaths over the most recent months. We're hoping that the increased activity in vaccinations, of course, is going to lead to a decreased pattern in hospitalizations and deaths.
And Fadi, we can't see the bars, and this is all on the public data dashboard, but could you just maybe verbalize?
Yes, I'm showing our 11th page of the case dashboard. On there, we display ages by decades, and you're free to select any time period you would like in order to investigate and compare age distribution of cases. We also allow folks to check off if a case has been hospitalized or deceased in order to see that play as well against the time period.
This is Yolanda. I just wanted to mention that Colorado College, they're not going on spring break. And I was wondering if you knew if UCCS and or Pikes Peak Community College was doing the same.
I don't have that information. Susan, would you?
Yeah, I'm not
know
sure
the
if that's
specifics?
anyone for our schools team, but we can get back to you with that specific. Anyone from our higher ed or our school teams on the call?
Vicky, I think it's a touchscreen. You might be able to just scroll it up a little bit to be able to.
We can't see what that big bar is.
I wanted numbers per decade, not an explanation. I wanted some specific data.
Okay, so let's do it. Let's do it. Bonnie, if you can go back to the bar chart. Please.
Sure.
In the chat, uses
Okay. And scroll up just a little bit. Can you move it upwards just a little bit?
They want to know what the big bar is, the numbers on there.
Yeah, the blue bar.
Sure.
We need a breakdown per decade. Is that correct?
I'm just curious.
Breakdown per decade. You have that, please.
Sure. I'm selecting March, if that's okay, unless we want a different time period.
March is good.
That's fine.
Okay. The most cases, we've had a total of detected cases of 3,037. The most were among the 20 to 29 with 774. And the 20 to 29 are the highest percentage of age group in terms of the entire population reference. They make up about 17% of our population, 17-18%.
So we've seen a really dynamic switch in that age group of positive cases then.
What we can do is we can dig a little bit deeper into that in order to get the specifics and provide that to you by the end of the day, just to make sure that we're speaking accurately about the comparison between month to month, all time versus March, and age distribution.
Because it seems like that's the age group going back to school, going back to work, and are we seeing that increase?
And they're not being vaccinated yet.
Yeah.
Bonnie, pull up just February as a comparison.
Okay.
And then Carolyn Gary, who is our part-time grant writer, also is a professor at UCCS, and they have a split spring break this year.
Yes, we'll be happy to dig deeper and analyze the age distribution of most recent times compared to all time or even just 2021, and can provide that to you.
So for February, I can see it a little bit. The same age group as the 2029, the big bar on there.
And we're not planning on vaccinating that age group probably before July. Is that?
No, so in anticipation of what the governor has said, mid-April, it will be open up to the general public, which will be 16 years of age and older, because the Moderna vaccine is approved for 16-year-olds. And then I know that there's some testing going on, trials for 12 and up, but it should be mid-April, and there's going to be a progression if what we're being told is true around production, that there will be some increases in vaccine that we'll be able to provide more vaccinations.
Hey, Dr. Johnson, do you have a comment for us, please?
Yeah, I believe there is a study out of Israel, and Stephen and Fadi, you can help with the details of it, but it is showing significant decrease in the severity of disease and hospitalizations among those who are vaccinated. And because of their spread of vaccine in that full distribution, they're able to gather data in a pretty meaningful way. I was wondering if we could go back to December, though, because if you look at February, we see that while there is still the 20 to 29-year-old is dominant, we're seeing decreasing cases compared to March. And I think that we'll see those numbers of cases in the demographics of our older population begin to shift with the vaccine, which is actually really great data to indicate how effective our vaccine efforts are in suppressing not only the severity of disease, but that transmission. So anyway, you can see that there's a little broader curve to this, with the 20-29, again, dominant, but they're also the most active and out and less likely to perhaps wear a mask and keep their group small. But we see a significant increase in the number of cases in that 60 to 90 year compared to what we have in March, after we've had months of vaccine effort into that demographic. So I think just a nice point. Thank you, Fadi.
So, Dr. Johnson, you make a really good point here in that comparing, say, December through against March, we've seen a decrease in the older age groups, which could reasonably be attributed to the vaccine. So I would think that this demonstrates that our efforts to vaccinate our population are working for those groups that have been eligible and received. Is that a fair assessment?
Yeah, I think that that's a good preliminary assessment, and it's, one that we can dive into deeper with Fadi and Stephen, because I'm sure Stephen will have caveats to the data, knowing this is all.
Okay, Stephen.
Robust discussions we have, but I think that it's a really good first indicator that our vaccines are having the impact that we've anticipated, and that we look forward to as we see increasing distribution of those vaccines across population to achieve herd immunity.
No, you're right. And Dr. Johnson, Israel is a breathtaking experiment because of the scope and span of their vaccination campaign.
My concern is this group of 20 to 40. They're the ones that, if you look around, aren't wearing masks. They're the ones that are aggregating. And what are we going to, is there some way we're going to be able to connect with these people? Because so far I don't think we have. And if we don't connect with them, then I'm afraid they'll be very low on taking the vaccines, which probably is the same thing with influenza if we really looked at it. At least that would be my thought. And I have a real concern about that. I'm concerned about the younger people because I'm not sure that they're listening. Mm-hmm. Well, and every kid that's 20, almost all of them, as we know from our own past experience, they're immortal until they die. Yeah.
Well, we share the same concerns, and we're going to get into a little bit of information around vaccine hesitancy. We have been working with the Regional Recovery Council, which includes higher education, and also we have a schools team that works on a weekly basis with the K through 12, but then also the higher education. And, now that, so it's been a challenge because there's been limited vaccine supplies and there's been priority groups. But as of March 19th, that has opened up and to restaurant workers. And so we know that there are younger restaurant workers, and they also, go to college. My daughter is one of them. She's 22, and she was able to get her first dose of vaccine as well. And we held a special pop-up clinic for restaurant workers that was walkable downtown yesterday. So we're working with so many different sectors and private partnerships as well as public partnerships to try to do all that we can to get in the people to be vaccinated, educate them, and then give them the opportunity. And I know that UCCS also was making some progress also because they can be an approved vaccination provider, so easy access to points of dispensing. And like Lance Bolton with Pikes Peak Community College, I mean, he's steadily taking our information and also to promote the vaccine campaign. And we're going to get a little bit more into the vaccine campaign, but we're steadily working to educate, inform, and increase access points for individuals that want to take the vaccine, because we want to blanket as much of our population as we can, and it's going to open up if it's true that the production is going to increase and significantly March and then April. So with the mass vaccination site down at the World Arena, and we're also looking to open additional mass vaccination sites at the Chapel Hills Mall, but that's under discussion, but wanted to acknowledge that we share those concerns, and we are steadily working on vaccine promotion. Are you going to pick up the vaccine campaign?
I can give some high-level updates on the vaccine numbers, and then we can move on to the campaign if that's okay.
Sure.
Okay. I'm transitioning to our COVID vaccine dashboard. Just wanted to point out some exciting news. Okay, it is loaded now. We've currently, as of March 22nd, given out 224,000 doses. The exciting thing about that is about 35% happened during 22 days in March. That really shows the explosion that is happening currently in the doses that are being dished out. We've increased our capacity, our supplies are increasing, and that's translating into not only more doses being given out, but more and more people being vaccinated and catching up on the second dose, meaning that they're fully vaccinated. Currently, we've vaccinated about 137,000 people. That is an underestimate. We do have the ability now on our dashboard, thanks to our partners, to show you that number in addition to federal estimates. So the 137,000 people vaccinated comes only through state data, but recently we were able to add federal estimates, and that number increases to almost 160,000. And that 160,000 people vaccinated is a cleaner picture of what's happening in El Paso County.
When you say federal numbers, is that for military and
the VA? The VA, the DoD.
So our partners, they were agreeable to share information in aggregate, but it's our military and the VA, and to Fadi's point about our increasing vaccine supplies and kind of an explosion, I'd say we're probably at about 80,000 vaccines administered within the first, within March, whereas it took us, from the beginning of mid-December to March to administer 14,000 doses because of the limited supplies. And so we can see that it's ramping up and opening up, which is encouraging.
Yep, right on those 83,000 just in 22 days of March. And that's, if you recall, that's given the limitation of some weather constraints that led to cancellation of appointments. So really, really an amazing trend that we hope to continue increasing the doses. Okay, we'll be transitioning back into the PowerPoint slide deck.
Sure. What we wanted to do now is transition into discussing the vaccine campaign, just as we've already begun talking about. And we like to think about it from our analysis side as having 3 phases. And so far, our national focus really has been on the first phase, which is adequate supply of vaccine. The news on that front is quite good. Every day we monitor open source information to track this. And in fact, the supply is improving dramatically. The second challenge as a community is to actually have the capacity to deliver the vaccine, which again requires an enormous investment and a lot of different skill sets. And finally, and this is the one that we've begun to discuss earlier, is that we have to have sufficient demand and awareness and opportunity to vaccinate to give our population the chance to become vaccinated effectively. We can move on to the next slide. And again, the supply piece of the puzzle is largely out of our control. Fundamentally, it has to do with vaccines made available to the United States public. Right now, as everyone knows, we have 3 vaccines that are currently available under emergency use, 2 mRNA vaccines that were first approved, and more recently, a vector vaccine, Janssen or J&J, as people call it. The vaccine supply, when we monitor these supplies, they are increasing pretty steadily. In fact, this week, the federal government will release, I believe, 27 million doses into the states. Last week, it was 22 million. So that's more than a 20% increase. So our point is that the supply piece is being solved. Also, locally, as you know, there were some issues initially with the state of Colorado and fair vaccine allocation by population. It looks like they've made amazing strides in that regard, and thanks to everybody who's been involved in that. Those numbers have now narrowed, and the vaccines that we're receiving from the state have now become in alignment with our population, which is fantastic news. And Susan, if you want to pick up the discussion of starting to deal with capacity in El Paso County.
Sure. So in El Paso County and Colorado Springs, we have a vaccine consortium, which is a triple action plan of leveraging existing healthcare infrastructure. And then the second part of that plan is to expand large-scale clinics and mass vaccination sites, which we consider their capability to be vaccinating 1,000, providing 1,000 vaccinations per day. And then our third part of that triple action plan is to increase equitable access to vaccines by reducing barriers such as language and transportation and technology. So to give you a little bit of the scope of what that entails, and we have many credible and appreciated vaccine providers in town. And so part of our vaccine consortium are 23 active providers who they went through a process to be eligible to provide the COVID vaccine. And keep in mind that the storage and the handling of some of these vaccines also are ultra cold storage and the logistics of all what goes into that. We are incredibly grateful to all the providers. So 23 active providers, 98 locations throughout El Paso County and Colorado Springs. We want to make vaccine accessible and readily available depending on what the supplies are going to do. And Fadi or Stephen will talk about this probably a little bit later, but we're trying to create more visibility with providing a map on our site that people can, they'll know where they can go to get a vaccine. And we have all of this information on our website. So that's expanding all of the time. Our access points, it's all dependent on the vaccine supplies. We meet on a weekly basis. That includes 2 county commissioners, Stan Vanderwerf, as well as Lojinos Gonzalez, and sometimes Cami Bremer and Stan Vanderwerf change out. We also have Mayor Southers, as well as some members of his leadership team, Councilwoman Yolanda Vila, Dr. Tierbush, all of our vaccine providers, including Dr. Vu from Mathers Vu. I know that he's here today. Chief Colas has participated on that, but it's a vast group. Congressman Lamborn's office participates on it. So it's a vaccine policy group as well as a vaccine consortium with the goals of vaccinating as quickly, safely, and efficiently as possible in El Paso County. Our current population is about 522,000 that are eligible just based on the requirements of the vaccine, and soon it will hopefully expand. But we've got one of the largest populations in El Paso County, so we have to make sure that there's multiple ways that we're getting the vaccine out, and we cannot rely solely on mass vaccination sites because that's not, it's not preferred for everyone. And just to, say a little bit of a story, my 80-plus-year-old dad can't sit in a car for that long. I mean, access to bathrooms and wheelchairs, and it's so there's different modes to reduce barriers to provide vaccine to our entire population. So that is ramping up. It's steady. It's going well, and that is in large credit to our emergency preparedness public health staff for setting that up, and our immunization staff, our emergency structure, but also our healthcare providers and our pharmacies. They are engaged. They are making this a #1 priority also, and we couldn't do it without them. So that is the Vaccine Consortium that has a triple action plan, and we'll continue moving through that as we go along.
Susan, this past weekend I was out at Calhan. Multiple people commented that they're hoping they'll bring the vaccine to them. Calhan, Peyton, the Eastern ranchers out there. Is there plans to do that? I know personnel is always, and transport of the vaccine is always difficult to logistically set up, but that was a request for multiple people.
And so we'll look into that. I do know that there is a Calhan clinic off the top of my head that is available, but those are areas too that we work together with our partners, and then if there is a need, then we will mobilize to bring those resources out. But one area that we are looking at is because we have the mass vaccination at the World Arena in the south part of town, but we know El Paso County is so vast, northeast, and so we're looking at different areas all the time.
Yeah, and they got the fairgrounds out there, so they got buildings and
our public health staff is scouted the fairgrounds. That we've also had a lot of businesses offer their sites up, Pikes Peak Community College up north, New Life Church, and what our folks do is they go do an assessment to see if it's a good flow, or whether it's indoors or outdoor. But those are areas that we will be fluid in and continue to look in and make sure that we're making the vaccine as easy and convenient for all, in El Paso County. And maybe you can just give me some points of contact also. Stephen?
Okay, and we'd like to move on now and discuss demand. Of course, demand is a multifaceted issue. As we discussed earlier, one of the big challenges is relevance. So there may be a wide swath of the community who sees no reason to become vaccinated. So when we say demand, it's a lot to think about. One thing that's really important is we want everybody's individual decision to be fully informed. And one of the big challenges is getting that information out. Information around vaccines can be confusing and controversial. And of course, it's been a long time now. We've been running through a pandemic now for more than a year. It's going to rely on a community effort. It's going to rely on multiple voices of influence. And we want to make sure that we increase access to vaccination, just as Susan has spoken about, for very many things. We've got to scale up the availability of vaccines, but not everybody's going to want to visit a mass vaccination site. So we want to make sure that vaccines are available through all channels that people are comfortable with. And again, we're having a discussion so that people understand that masking and vaccinating are our way out, and vaccines are really our way out of the pandemic. Let's go ahead and move to the next slide. The fundamental message, of course, is that vaccines are safe and effective. And this is a challenging message. Even more important, I think, is that vaccines, again, are relevant to our way out of the pandemic. The vaccines are proving quite safe. We've got a very rapidly increasing footprint worldwide and in the United States, one of the leading nations now in terms of vaccinations, that indicate that these vaccines are in fact safe. And we can go ahead and move to the next slide unless there are comments here. Again, fundamental message is we're going to get out of this thing by using masks and vaccines. So protect yourself, protect others by getting vaccinated. Our goal is to get our economy to recover, restore lives and livelihoods in El Paso County. So this vaccine campaign is going to be a long run. But again, as supply permits and as capacity is increasing, we need to vaccinate El Paso County.
Thank you, Stephen. And that's just, this is all on our website, but it's very easy to, well, I shouldn't say very easy.
Nothing easy about it.
We provided, how to register for vaccination on our website. There's electronically or to call 211 with Pikes Peak United Way or text vaccine or vacuna for Spanish to 667-8732 to get connected. And vaccinations are continue to be by appointment only, so it's important to get registered. And Lisa, do we have you on the Teams call? And if you are there, thank you. If you could also key in when you're talking about the planning and highlights from equity clinics, maybe you can touch on UCCS as well as Pikes Peak Community College and how we're working with them to get, and CC to get their populations vaccinated.
Sure, yeah. So I don't know if there was any slides that I put up today or not, but I will first, I'll start with just first apologizing that I am coming off of 3 different points of dispensing in the last week of several thousand of vaccines that we've been able to provide to our community. And so it's really exciting that we're doing this this kind of work, but it's a little bit back to back. So I didn't have as much time to put together slides for you guys today. And I'm going to do more of a highlight of what we've been doing, mostly because I think that Fadi and Stephen do a fantastic job of talking to you guys about the numbers. So I wanted to bring more of this. Here's the human side of what we're doing. Again, knowing that getting vaccine into arms is what's important, but really wanted to share with you what we've actually been up to for the last little while. So we'll start with this picture of highlights from equity clinics. And I wanted to mention that with the state, they have an equity task force at the state health department, and they and individual organizations who are looking for vaccines specifically for a group that meets equitable trying to access vaccine has the ability to apply for vaccine clinics. And so in the month of March, we've had the Resource Exchange, the ARC, the New Jerusalem Baptist Church, the Payne Chapel for Africans Church, Hillside Community Center, Peak Vista, Meadows Park Community Center, and Mission Medical, all doing some kind of equity outreach and vaccinating somewhere between 100 to 200 individuals at each of those clinics, or will be by the end of this month. There's a couple coming up this next week. Additionally, we did have our equity clinic this past weekend, which was our second, it was the second Moderna vaccine for the Latinx population that we had partnered with Cerveza de la Raza to do outreach to this specific community of first-generation Hispanics in our community. And we were able to provide over 1,000 vaccines in that community. 929 of them were the return individuals who had come to the first clinic, and we did another 100, a little over 100 more individuals who were there for their first time vaccine. And while we were there, what you're seeing on the bottom picture there is Servacio de la Raza receiving a $5,000 donation from an individual family who was so impressed with the work that we were doing that they wanted to figure out a way to help Servacio continue to do the work in the Hispanic community here. So that was an exciting and interesting, fun thing that happened. And then
Lisa, before you go on, Councilwoman Avila, do you want to talk about the importance of trust? And then with Servacio de la Raza, what made that a successful partnership is working with the navigators or promotores and kind of what that involves, because there's different areas that, you know, we need to key in on and implement in order to be successful. So
sure, Susan. Did I miss tamales? Were there tamales there?
Oh, so
you missed the tamales. Oh my
goodness.
that was so awesome. Yeah.
And that is how Latinos roll. That's what I'm going to say.
For sure.
And when you talk about the promotoras, those are individuals that are boots on the ground in the community. They know the language, they know the culture, they know everything. And so under Julisa's direction, Julissa Soto, we've all been able to meet her. She's amazing and a crack up. But the promotoras to actually reach out, to call, and if they don't have a ride to, they were assisted in setting appointments, and they actually went out there to make sure that they had transportation and made it so engaging. And I'm so excited about that $5,000, but it came with a lot of work, a lot of community love and involvement, and it was just so great. And I'm so glad to see that. And I'm looking forward to seeing how we're doing in the equity stats, because I think with all the work that's been done with the different churches and community centers and with the promotoras and Servicios de la Raza, I think we should be looking good. So thank you all for all your amazing work.
Thank you, Yolanda.
And I do want to mention when tamales are mentioned, so Servacio de la Raza, they took the initiative to make homemade tamales, homemade dessert, homemade, I think it's called champurranos, or some kind of drink from Mexico, as a kind of a bonding also with local public health staff and all of the partners there. And it was just a high energy, such welcoming integration also of public health staff. I know that there was some, I was a greeter, there was another greeter from the WIC clinic, and, bilingual, we had bilingual or Spanish language paperwork and English, and it just it was so fluid. People, you could see that they were so relieved non-verbally, and some people were cheering also, just to even be there. They were so relieved and appreciative to get their second dose. So it was great to see that in action.
Yeah, and I think that it was huge for us because this was the second dose clinic. So on the first dose clinic, the promotoras came in a little bit timid of working with public health, of integrating within our process, and this time around, it was much more welcoming between the public health department and the promotoras. By the end, like Susan said, second day, they were offering to bring food and brought in this wonderful food to share with us. And then at the end of the day, I went with Julissa's team to 3 margaritas, and we celebrated the work that was done. And our follow-up on this is that a few of the promotoras have reached out to ask if they can volunteer with us. They want to do some of the follow-up phone calls for people who didn't show up for that second vaccine. And then we took a waiting list as well. And as we begin to open up appointments Thursday and Friday and next week, we'll have the promotoras make some phone calls to get some of the people in who they hadn't been able to get in the past. Again, because of that trust issue, they are going to be able to, really talk about how engaging the public health department is, and how they can get people to our clinic without them feeling worried or concerned. So I think it was a huge success on so many fronts. backing up a little bit, we did also do the first Johnson & Johnson vaccine clinic on March 6th and 7th in our clinic. And that was a huge success. We did 1,500 vaccines in that 2-day time frame. And then quickly moved into March 16th, 17th, and 18th, where we partnered with King Soopers to host a clinic for frontline grocery workers. And the goal was to do 1,500. They were able to provide just under 1,000 of those vaccines during that time frame. And I'll also say that my team reached out yesterday to King Soopers, specifically to those pharmacists, to offer our support and condolences to the event that happened at their store the day before with the active shooter. And they appreciated so much our outreach in regards to that. We then I wanted to let you know that the World Arena did open on March 17th with a couple of bumps, but all of those have been worked out now. And that drive-through vaccine site is up and running really well right now. And the intent is to have that open 7 days a week here in the next week or so. And then yesterday, as Susan already mentioned, we did do in partnership with the Downtown Partnership of Colorado Springs and the Antlers Hotel, we were able to vaccinate just under 1,000 restaurant workers and people in the retail food industry with the Johnson & Johnson vaccine. And then today we're continuing to work on our Operation House Call, which is, again, the program where we are going out to homes where people are homebound, unable to leave their homes, and offering vaccine. That partnership is with Colorado Springs Fire Department and the Medical Reserve Corps.
Thank you, Lisa. I also wanted to mention that the state is trying to start a statewide program for vaccinating homebound individuals. And so our Operation House Call with the Colorado Springs Fire Department and the Medical Reserve Corps has been referred to as a model practice. So a model practice coming out of El Paso County that they are looking at very closely. And so I think that's always exciting when we're leading the way and can be helpful on how to approach work.
Yeah. And then, the Downtown Partnership restaurant vaccine clinic was so successful yesterday that the Antlers brought champagne in at the end of the night to offer to all of those who were sitting there waiting. It was quite cute while they were passing champagne around to everybody who was waiting for their 15 minutes at the end of their vaccine.
Makes me regret I've already got my shots.
That's how they do it, I guess, in the restaurant industry.
Champagne, tamales. I mean, this is good stuff. I'm just saying.
And we also partnered with the Pikes Peak chapter of the Colorado Restaurant Association. The president is Greg Howard. So, I mean, you can see the theme here. It's just like we can't get our work done without our partners, and they just have been fueling much of the outreach and the success. So thank you, Lisa. Let's move on to Dr. Johnson and update around the variant strains.
Yeah, so before I jump to the exciting variant world, I want to highlight the work that you just talked about, Susan, in that collaborative realm. And we have ongoing opportunities for that and are working on the education piece, bringing it full circle to what Stephen was talking around to promote the demand as well. So we had the opportunity to work with Colorado Springs Community Action Coalition and did a full panel with them going through the safety and efficacy. We've worked with Centura and one of their providers there to bring education into El Paso County Public Health. And Colorado Health Ethics Forum will be doing a panel on April 22nd around rural challenges. And I think that was that Vicki who brought up some of those rural challenges and really reaching out to understand and hear how we can continue to promote that. Michelle Hewitt's working with Telemundo and Peak Vista on some Spanish-speaking opportunities to really bring the language and message home. Pikes Peak Library District has a great outreach and are working with us. Kyle and I get to work with them directly, and the minority leaders meet every other week. And again, Kyle and I sit on that panel listening and hearing from them where they feel that we could really target those messages. And so I just want you to understand some of that cross-sector and outreach that we do, but also to invite you to bring other opportunities to us to get this message out robustly. So with that little plug, I'm going to jump right into the variant strains update. So next slide. So this is in the news a lot, and there brings up, there's variants that we see among viruses. We anticipate that because they are trying to assure that they have a life cycle that can stay robust. So they want to know that, not that they truly have consciousness, but they want to know that they can, transmit easily. And they want to find that little niche where they can, go ahead and thrive without really doing too much damage to their host, because they need that host to be able to transmit it on to the next one. And so as we follow these variants, there are the ones that are coming to the news are of concern, and they are of concern for us in the middle of this pandemic due to the fact that they may be able to spread more quickly. They have greater transmissibility, or they may begin causing more severe disease. And there's always concern that they would evade diagnostics or treatments, or some of the immunity that we're able to obtain. And there are 4 at this time that are on our radar. They're referred to typically by their numbers, but we also, people will refer to them by their name of where they were first identified. So in those are listed, the B117 that came out of the UK. It is of interest in Colorado because we are seeing it here, and we've had 38 cases in El Paso County. The B1351 is out of South Africa, and it, again, has been seen in Colorado, and 33 cases in El Paso. There's a P1 variant that is out of Japan and Brazil, and fortunately we are not seeing that in Colorado at this time. And the B1427429, which is a variant that has emerged out of California. There have been cases in Colorado, 224, but we aren't seeing any of these in El Paso County at this time. So next slide. Oh, I'm sorry. Was there?
I think we had a question, Dr. Johnson, from Doris. Doris, did we totally drive past that?
Well, I had a question about, one is on the South African variant. There are 11 Colorado cases and 33 in El Paso County. So there must be something wrong with those numbers, correct?
Yeah,
that's a mistake.
Wrong number.
Yeah.
Pardon me?
Wow.
That is correct. That's a mistake. El Paso County shouldn't have 33 in that column.
Okay.
The 11 are only in the state of Colorado, all in one place.
And then I have a question on outreach. I know we've done a lot of outreach to our African American and Latino communities, but what about the Asian communities? I know it's a small community in our in El Paso County, but still it's significant, and was curious if we've done any outreach with that particular population.
Yes, they sit on the minority leaders group, and we do hear from them. I am not, other than that conversation and reaching through those leaders into the community. And Pikes Peak Library District, some of their efforts. I am not aware of other specific efforts. Lisa, are you?
I can speak to that a little bit, Dr. Johnson. So we formed a partnership with the El Pomar Emerging Leaders Program. And, you know, one of our close partners is Stella Hodgkins, who has been really spearheading this effort with minority leaders. And there are Asian members, which she is a leader and Asian herself within that group, but there's also Island Pacificers, Native American, and there's many different groups where they are helping us outreach. But I think the main effort that we're involved in is listening on how can we best support communities, and then doing outreach from there. But that's one of our main connections.
Okay, thank you.
And I have a correction. Thank goodness for Haley. The 33 in El Paso County is not actually South African. It's the U.S. California variant. That's the B14729. Pardon me?
The California twins, that's right.
Yeah, so that 33 should actually be in the last column.
B127, right?
Yeah. So the concern about these is the way to actually impact our variants is to really suppress that transmission, so they don't have the opportunity to sit in hosts and create a pool for their own mutation. And so while we are monitoring those and looking at the implications, the most important thing that we can do is truly to just stay the course. We need to continue wearing our masks and get vaccinated, because the more that we suppress the actual transmission and infection rate, the more we will also suppress any opportunity for the virus to mutate into forms that create more challenges for us. So I'm complete at this time with that presentation, but want to open it up to questions if there are any, because it is, there just is so much in the news about this.
Questions for Dr. Johnson? I have a question, and my understanding is that first it was a limited supply, second it was some logistical challenges and sufficient healthcare workforce to administer and locations and so on. But the third hurdle that perhaps we're anticipating is enough people who want to continue to participate and get the vaccine. It's the demand issue. Can we? I know this is a well-trod path, but is there some way that it would be possible to incentivize getting the? I mean, it's obvious that you protect yourself and you protect others. I wonder, for some people, if that's not enough. Is there any way to, other than tamales and champagne, how can we incentivize people getting the vaccine? I think that's a hard one.
That I think is a hard one, and it comes back to a lot of discussion, Dr. Turbush, around resource allocation and bandwidth and ethics. We have utilized some incentives in the past, and so we know when we were doing our Hepatitis A outreach, did some research and incentivized a lot of our partners. One, our homeless neighbors really responded to certain individuals positively. So we brought in Velda who had a great relationship with them because they would accept a vaccine from her more readily. But we also incentivized with socks. So for a pair of socks, they were really willing to get a vaccine. So those are some interesting things that, you know, we do discuss. I think that when we look at some of the incentives, they aren't always in, you know, monetary or even, you know, one of the things in our 20 to 29, I think Dr. Bucks raised that question. You know, you stop and think, what is their value proposition? And so how do we message this in a way? Is it that it's somewhat edgy and you're a little bit more of a, you know, disruptor if you go ahead and get your vaccine? Maybe that's a message that we could put out there. And so really listening to those populations and hearing from them where they think that we can help to incentivize either with message or relationships or, you know, in some cases a pair of socks or something else. But that's a really good question. Thank you.
Well, thank you.
Can I piggyback onto that just a little bit? That's kind of what I was talking about with the Eastern El Paso County. You've got, El Paso County is very unique in how we have these subsets of populations and different beliefs. And you've got that farming and ranching community that we have not really touched with anything in the past. And I know I'm leaving, but if somebody could explore making connections with them, although they're not an ethnic group, they are a very powerful, like-minded group that hits thousands and thousands of people. And I think it would behoove the health department to look into trying to connect with them.
And part of that triple action plan is, you know, increasing equity and reducing barriers. So reducing barriers is not only aimed or to be helpful to minority populations, but there's so many different aspects of reducing barriers. And whether it's, you know, providing the education and you know, forms and formats and through different trusted people, or providing access to vaccine geographically, or, you know, however we can reduce those barriers, that's what we're interested in doing. And however we can incentivize getting the vaccine that is, you know, non-monetary.
Right.
I think that's really important, and that goes to strategy with the vaccine consortium and different trusted partners and groups, and you know, different strokes for different folks. In one way, with one size fits all doesn't work with so many so much diversity in El Paso County communities.
And for that particular group, I was talking about the farmers and ranchers. It's trust. There's a lot of fear. We talked about that, about vaccines and the government mandating something. And, you know, I just think that working on that trust sooner rather than later would be a very good thing.
Yep.
All good thoughts. Great. Anything else? No?
I don't have anything else other
Thank
than
you.
Thank you, Vicki and Dr. Bucks, and we'll miss you.
Yes. Well, okay. Well, thank you, Director Whalen. Let's see, from my notes, thank you, Mary Ritchie, for being our county attorney today. It's always good to have you looking out for our welfare. Thank you, Kelsey Martin and Christian Wright, who've been doing some of the IT support and so on. Is there any public comment, either here or virtually? Comments from the public are always welcome, and we do set aside this time every month to hear from the public. Okay, I think we need a motion to adjourn, unless there's any other comments from Board of Health members. No? Looks like the next Board of Health meeting is on Wednesday, April 28th at 8:30 in the morning again. Okay, move to adjourn. Second. All in favor?
Aye.
That was it.
Every day.